Dr. Lushila Mali, also known as the Tutor, and welcome back to my channel, or welcome if it's your first time seeing my face. I'm gonna need all the concepts to come to the front. How's your year really been going? Because this year has been a lot for me. Now I know I haven't been uploading as regularly as I should, but I'm back and I'll be posting every week for you guys. Well, at least 3 times a month, which is better than me going ghost on you guys. So today's topic is 5 things you do not want to do in ComServe, because these things can literally cost you your ComServe to the point where your ComServe is extended and you don't really get paid for that. So that's like being a student again, working for free. We were working like dogs day and night in those clinics.
And I work like a dog day and night, living off a coffee from a pot none of you want to touch.
You don't want that to happen to you as a professional healthcare worker or as a registered doctor who's currently doing their ComServe. Listen to this video and take notes, guys. So, number 1, don't be rude. I know this seems so obvious, but a lot of people do not understand the importance or how far just simply smiling at work or being kind and generous to your colleagues can be. It can create opportunities where you get to talk to people that you don't really talk to who work in the hospital, or it can create opportunities for you socially or at work even. Maybe getting to know your manager more will create opportunities for you to know about more outreach programs, how the hospital actually works. So you can learn a lot of things within your ComServe year if you are just more lively at work. Now I know for my introverted people this can be very difficult. Me myself, I like to keep to myself at work. I should actually follow my own advice. These days I've been really challenging myself to put myself more out there, to talk to colleagues that I normally do not talk to on a regular basis, just to get to know people, because you don't know when you're gonna be in need of something. Maybe if I create more connections in other clinics or wards such as maternity or pharmacy, that could really help me, because if I end up being sick or I need to see one of the specialists or doctors, I can literally have their number on my phone and just call them on my speed dial and just tell them what's going on. Whereas if you're more shy and you always keep to yourself, sometimes you could be dealing with a health problem and you just don't know who to get the best advice from or to get treatment from. Because what I love about being in a hospital, if you got the right connections, baby, you do not have to worry about medical aid. I mean, yes, medical aid does a lot for you, but just knowing the right people could get you that medication that you need, or you could get treatments that you didn't know that were at your reach at your hospital, instead of traveling to a different health facility to get these treatments. The reason why I keep to myself a lot is because I'm very much intimidated by the age gap between myself and my fellow colleagues. Because there's nothing more nicer than, you know, just chilling with a fellow Gen Z or someone close to your age, where you can talk about things such as Bridgerton, talk about boys. Like, it's just fun times all around when you feel like yourself, or when you feel free at work and you are able to just communicate with your age group or peers that have similar, I would say, interests to you. I totally had to learn how to make new friends, because I'm literally in the middle of nowhere in Eastern Cape. So I was just thrown into this unknown small little town with new colleagues and new housemates. I had to learn how to socialize and how to make friends again, because for 5 years I've had the same friends, I've lived in the same reses. I just was used to my same old. So coming into my new, I had to learn new skills. Sometimes being polite is difficult at work, especially if you're dealing with not only difficult colleagues, also patients. Patients can be so rude. Like there were times where I felt like I was just a service, like I was not treated as a person by a patient, where they would literally just walk into the clinic. They would not greet. Even if I greeted, sometimes they would just miss me like in real time, and I'm like, you left me on red. They just sit down and then they point at their teeth. You always want to try to be polite, greet your patients, greet your colleagues, you know, just do a little small talk, just a little small talk, because it's really hard if you're working in a government facility because you have so many patients lining up to come see you. But it is really good to be mindful of manners and just keep it cool even when you're dealing with stressful or very rude patients, because sometimes, guys, the customer is not always right. Number 2, don't be afraid to say no. I know this is hard for a lot of people who are people pleasers. I am a recovering people pleaser. It's not always easy saying the word no, but you have to stand your ground at some point. Number 3, not being enthusiastic. Guys, you need to be more enthusiastic about your work. I know sometimes it's so boring doing the same thing every day, all day. For me, I extracted 90% of my day. It's become so routine. It's hard to be enthusiastic and passionate about it. So what I try to do to spice up my schedule, I do things that I love. If you guys have been following me on Instagram or TikTok, you already know the vibes. I am such a pros girly. I love prosthetic work. That's where I thrive. So I'm not a big fan of oral surgery and all that bloody stuff. Like, I'm not really a fan. So what I do to keep myself, you know, excited about my week or happy to go to work, I always schedule at least one patient a day, do either a cleaning or a filling, or to see one of my prosthetic patients. That's what keeps me going, literally, because I cannot stand doing extractions. I hate the blood. It splatters everywhere. It gets in your eye, it gets on your face, it gets on your new shoes. Like, child, no. Because if you're not excited to be there, everyone else can see it. Your supervisors can see it, your managers can see it, your patients can see it. So you need to try to be more energetic at work. No one wants to be treated by a dead person who has no life, who doesn't want to be there. The patients already don't want to be there, I'll tell you that much. So you don't want to create the vibe that you also don't want to be there. It's just negative energy all around. Like when the patient is there and you can tell that they're not really excited about this extraction, calm them down, be enthusiastic, be like, okay, it's gonna be okay, don't worry, it's not that painful, just relax, calm down. That's what I always do, and that creates a better vibe. You find the patients becoming more comfortable in the chair. You see them opening up about how painful the tooth has been, or how they haven't slept, or their kids, you know, all these other stuff that you would have not found out about the patient, just to make their dental experience more pleasant. And it creates a better reputation for you, because I've heard so many patients who have come in the clinic and be like, you know what, I heard there are these doctors that take our teeth so nicely here at your hospital, and it's so nice to hear advertising you guys to everyone in the town. And it's a pretty small town, so everyone, you know, it knows everyone. So it's very nice when people just walk in and they're really comfortable without you even doing anything, just because of the energy you created for that one specific patient on that specific day. Number 4, do not overshare at work. Oversharing at work is not okay. Unless you work with your actual best friend, then that's something else. But I would not recommend oversharing any of your personal information with any colleagues, especially if you're gonna be there for a year, like ComServe. Like, if you're gonna be there for a short duration of time, I don't recommend sharing personal details. You can talk to people, you know, tell them more about yourself. I mean, no one wants someone who's boring, so you can spice it up a little bit, you know. Also need to keep in mind that some colleagues are not genuine people. They just want to spread your gossip all over the hospital. So stop telling everyone your tea or your whole life story. Sometimes people just want to straight up embarrass you, and I don't want that for you, bestie. So at work, you want to keep it professional. When you address patients or colleagues that you haven't really we interacted with, you want to call them by their titles, or in the hospital we have this thing where we call people by their last name, so it's not disrespectful. For me, I can't call older people by their last name or first name, so I always say mama or dada or budi, sisi. That's like part of my upbringing. Mom never let us call older people by their name, so I just keep to my mama and dada. Also, you want to dress professionally. You don't show too much skin at work. It's not cute, you know, and it can be distracting from your actual performance as a professional. People do judge you by the way that you present yourself and how you look, unfortunately. So you want to create that great impression that, you know what, I'm a professional, I deserve to be here, I belong here. If you're like me, who doesn't like people's DNA all over their clothes, I always wear scrubs every day. I make sure that they ironed, and yeah, that's just what I like because it's more professional and I am comfortable in my scrubs. Just as long as they're clean, I'm clean, and I make sure I shower myself in perfume because I love smelling good. I want patients to come in and just, you know, have a work for me and be like, ooh, she's that girl. You don't want to be known as sloppy or you can't dress or you smell bad. Yeah, Lisa, guys. And that is it. Thank you so much for tuning into my video. I will see you guys on the next one. Please make sure to like, comment, and subscribe. And have a great week, besties.